Hi class, and welcome to week 3 of health policy. So in this video, I'll briefly be going over the information presented to you in this week's module and just kind of going through the content pages as well. So let's get started. Before I go any further, I'm just going to quickly remove myself from the screen and we will get started. So as always, learning objectives for the week. We're covering 2 chapters this week. Chapter 6 on individual issues in healthcare policy and law, and Chapter 7 covering social determinants of health and the role of law in optimizing health. And below that are the learning objectives and then the assignments for this week. So this week that you have 2 assignments. First one, your health policy outline. And I put detailed, the word detailed in brackets, because I expect a very detailed outline. And remember, this is kind of your blueprint or your layout of how you're going to be presenting your health policy topic. The more detail you include, the easier it will be when you're putting together your presentation and you know what you are covering. Now, I do expect in-text citations throughout your outline. That way I know where the information you're presenting, or I guess the best way to say it is which source you used regarding the information you're presenting. And your reference list needs to be at least 5 sources. So I'm going to quickly jump to the sample outline. Now you have access to a sample health policy outline in the Canvas module in our course titled Student Resource Module. And the first content page in that module, which is assigned course projects, you go into that content page and you'll be able to retrieve the sample outline. Now, the reason I keep focusing on health policy outline is the structure of your outline that you'll be following is a health policy analysis from chapter 14, which we covered last week. So you're going to research your topic and then you're going to get that information. You're going to lay it out following the structure of the health policy analysis that we covered last week. So let me jump to the sample outline real quick. All right, so here we are with the sample outline, just an example for you guys to follow. As you can see, here's the problem statement, which is similar to the thesis statement, but here you're actually clearly stating or identifying the issue at hand. And then you're going to go through the different components of the health policy analysis. As you can see, in-text citations are included. It's a very detailed outline. I understand what they're going to be covering for their video presentation. And this way, and it's also easier for you because you have time to kind of brainstorm how you want to go about addressing this topic. And let me quickly jump to the reference list. Again, it needs to follow an APA format. I always recommend for my students to check out the Purdue Online Writing Lab. It's a great reference for following the APA writing style. So your in-text citations and your reference list does need to follow that writing style. All right, so I just wanted to kind of very briefly go over that. I'm going to jump back to our module, but I do want to go to the Purdue Online Writing Lab really quick. I know our library has one as well. I personally use their website as a reference. As you can see, I'm actually on the page for the Writing Lab. I'll make sure to include the web link in the module. But really quick, here's all the different types of in-text citations. They give you the basics, authors, if there is no author, if a publication year isn't indicated, whatever the situation. But it's very easy to go through and, find what you're looking for. So if you have any questions, again, never hesitate to let me know. I'm going to jump back to our first content page in Module 3. So here we are back. Okay, so that was about the health policy outline. It is due Sunday. And then you have quiz 2, which is a multiple choice true and false quiz. And again, here are the readings and the video lectures. So you have one for chapter 6. There are actually 2 videos for chapter 7. One briefly going over social determinants of health. And below that is a short video that goes over Healthy People 2020. All right, so let's jump to the next page. Here you will find the PowerPoint presentations that go along with the assigned readings, and then some information from the chapter. So the first little piece of information here regarding EMTALA, which is the Emergency Medical Treatment and Labor Act, which was actually enacted in 1986 as part of the Consolidated Omnibus Budget Reconciliation Act of 1985. So it was originally designed to prevent hospitals from refusing to see patients based on their inability to pay, and to assure they transferred patients only when appropriate and in a safe manner. Now, today, EMTALA continues to affect physicians and hospitals nationwide in a number of ways. Compliance is especially important for physicians and their emergency departments to ensure both quality and safety for patients and hospitals. So that's a little, and here's more information on it. And then we have chapter 7 covering social determinants of health. So when we're talking about social determinants of health, these are factors that impact one's health. So a lot of times factors that determine health policies include behavior, biology, policies, social factors, and health services. Now, each of these factors interact with and influences each other in different ways. Now, one of my favorite kind of layouts to really explain, or I want to say a framework that really explains this concept of social determinants of health, is this force field and well-being paradigms of health, which was created by Bloom. And it's been used extensively by health planners and health educators to provide the rationale for a systems approach to health. And so the idea here is that health is an interlocking combination of physical, psychological, and social well-being. So the major determinants of health include healthcare, genetics, environment, and behavior and lifestyle. So when we're talking about healthcare or medical care, this is influenced differently than other factors of health determinants. You know, this is because it's not always accessible or affordable for everyone. It is also a factor that's sought after for health purposes and therefore has a higher demand. And as pointed out here, one of the most important parts of the healthcare system that makes the biggest contribution to good health are preventative services. And that's really the shift we've been seeing for the last, I want to say 10 to 15 years, is rather than having this treatment-based healthcare system here in the US, we've been in this process of shifting it to a more preventative approach. And then you have these individual factors that are molded from like demographics, behavior, socioeconomic conditions, which are also heavily guided by environment. Now, when we're talking about demographics, we're talking about genetics, right? So this is age, gender, race, and ethnicity, medical history, and these factors impact overall health. And then you have lifestyle behavior choices. And this consists of your diet, behaviors, smoking, not engaging in risky sexual behaviors, lack of exercise. When you take on these unhealthy behaviors, you're at a risk of negative health outcomes. And then your socioeconomic conditions. So these are made up of your occupational circumstances, income, and education. And what's been found is that people with lower income and education levels often make less informed lifestyle decisions and lack of funds to address their health regularly. And this was very evident, and it is evident in many underserved communities. Regarding the research I was involved in with migrant farm workers in Immokalee, which our sample size was about 442 males. And when I was analyzing the data, this, one thing that came out very significant is regarding education and the risk to sexually transmitted diseases. And of course, those unsafe or uninformed, less informed decisions, lifestyle decisions impacted that. I noticed that the mean or average level of health education among the sample I was looking at was about 7th grade, and they had a very high risk of sexually transmitted diseases due to unsafe lifestyle choices, which included risky sexual behaviors, as well as very high levels of alcohol consumption frequently. And we also had, I would say, a smaller percentage. It wasn't so many that consumed regularly drugs, kind of like the stimulants, like crack cocaine kind of thing. But and then you also looked at their living situation. And a lot of them lived in labor camps, and which I honestly never heard that concept before until we actually went to go visit the site. And this was before the study was implemented. And a lot of these migrant farm workers that that were included in this HIV risk reduction study lived in these labor camps where you would have 8 to 9 men living in an apartment, and the living conditions were very poor. So all these different determinants impacted their risk and ultimately impacts one's health. All right, so I know I kind of went off the tangent there a little bit, but really quick, I know this video is getting a little too long. Here we have our framing legal care as health care. Make sure to read about it. It is in our textbook. And this is following the MLP model or approach. And here's the MLP approach to social determinants of health. All right, now I'm going to jump to the last content page. And this, again, are the videos for this week. They are optional. They are there to help kind of add to what you're learning in the assigned readings. We have Chapter 6, Understanding Medicaid. And then Chapter 7, covering social determinants of health. And this is actually a great TED Talk. I strongly suggest for you guys to watch it. It's by Dr. Claire Pomeroy. She does a great job, and she kind of talks about her upbringing and the impact of determinants of health and how they're major factors that impact one's health and well-being. And then here's another video on determinants of health, looking at Healthy People 2020. Here's another video on the impact of social determinants in health disparities that exist here in the U.S. Here's on the MLP approach, or the medical legal partnership approach. And last is, again, Healthy People 2020. Now, remember, the links for the assignments for this week are found in this week's module. That's the best way to access those links. If you have any questions, never hesitate to reach out. Take care, everyone. Bye.